Sedation in dentistry really helps that anxious patient. And so if you're nervous about having dental work done, sedation is a great option. Also, there's a lot of patients that have a pretty sensitive gag reflex. And so, with us working in there, sometimes that can set that gag reflex off. And so sedation's a wonderful solution to that. So we've had patients that, you just look at them and they start gagging, and we've been able to treat them comfortably and not have them, gagging when we're in there working. Yeah, so we have multiple sedation options here at the office. Probably the most common one would be laughing gas. And so laughing gas, it's really nice because it sets up quickly and it wears off quickly too. And so you don't need a driver to and from the appointment. It kind of relaxes you in the twilight. It's kind of like, when you wake up in the middle of the night, that feeling, or having a glass of wine, it just kind of will mellow you out and makes the treatment a lot more comfortable for you. Oral sedation is another great option. So oral sedation, you do need a driver to and from the appointment. And so typically there will be a pill that we prescribe you the night before and about an hour before you come in to the visit. And so that is going to put you in a deeper sedation than what laughing gas will. You'll still be able to walk with assistance. You'll still be able to respond to commands, but a lot of patients that are on the oral sedation end up falling asleep while we're working on them. We have some monitors that will monitor you for safety to make sure you're doing okay. But you will need a driver to and from the appointment, and you will be out of commission really for the rest of the day, so no driving or anything else like that. One disadvantage with that though, with the oral sedation, is Ohio is what we call a single dose state, meaning that we can only give you one dose of oral medication to take. And so if the sedation is not quite enough, or if it's too much, there's no way for us to titrate that or to adjust it to be perfect in your situation. IV sedation is a step up from the oral sedation. A big advantage with the IV sedation is we can titrate it or adjust it to your need. And so, we're able to sedate you in a much more predictable manner. Also, we can give you more throughout the appointment. And so with oral sedation, we can only give you one dose. And so the IV sedation, we can give you multiple doses. So if we are in here doing working on multiple teeth, a bit of a longer appointment, we can keep you sedated through the whole appointment. Candidates for sedation, really, you have to be a relatively healthy adult to be sedated here in our office. We do have options where we can have an anesthesiologist come in that can sedate you if you do have some medical complications. Also, we can only sedate people that are 13 years and older. Laughing gas is safe for kids that are under 13, but any of the oral sedation or the IV sedation, legally we need you to be at least 13 years old. When we're talking about treatment plans, we get a lot of times we will bring sedation up for certain procedures that are maybe a little bit more invasive. Also, for longer procedures, sedation is a really good adjunct because it will help you stay comfortable. So even if you are a person that is comfortable coming to the dentist and having treatment done, if you're in the chair for a long period of time, it can be, sedation is a great option to help with that appointment. If you as a patient want to be sedated, that's something, we do talk about it some, but, that is something that you can bring up also. And so, we can sedate you, so that's something that you can bring up also. And so, we can talk about the different options that are available that would work best for your treatment options.